Next will be the Ohio's update. That's going to be by Dr. Margie Ream, pediatric neurologist for Nationwide Children's Hospital.
Hey, everybody. So I'm presenting on behalf of the Ohio Department of Health and Sharon Leonard, who helped collect this data and is a supervisor in the newborn screening lab. Next slide. So Ohio started lysosomal testing in 2016 with Krabbe and then added Pompe and MPS1 over the next year. Testing for LSDs involves multiplex of the relevant enzymes with MSMS. And our test method for XALD is we look just for C26 and we don't look for any secondary markers. Our samples are usually received by the lab on the 3rd day of life and reported out on average on day of life 8. If the screen is positive for Krabbe, Pompe, or MPS1, the results are called to the PCP and the closest genetic center, and the two of them coordinate who will inform the family, and they get the diagnostic tests scheduled. For XALD, we're doing population level kind of pilot studies. So the results are not on the official report, but if it's positive, the local genetic center will get called. Our state lab follows up for up to a year to try to obtain the diagnostic test results and then the final clinical diagnosis. But after a year, the case is closed. And the numbers in these slides are reported through June of 2020. Next slide. Oh, this was out of order. So this was supposed to be before that one. I am a member of the evidence review group for the Advisory Committee for Heritable Disorders in Newborns and Children. And so this presentation does not represent their views or their views of the evidence review group. Next slide. So for Ohio Krabbe screening, it started in July of 2016. We do not test cytosine. We do not have a second tier test for Krabbe. We rely solely on enzyme. And as a result, we have a high positive rate, most of which are false positives. So we've screened, nearing 800,000 babies with 416 positives. 2 early infantile patients have been diagnosed and went to transplant. There are 5 late onset diagnoses and 5 considered at risk. We have an additional 12 pending. Ohio has a unique situation in which families basically have a line item veto for Krabbe, so they can accept newborn screening, but specifically opt out of Krabbe. And our refusal rate for Krabbe has been pretty steady at about 1.4% over the last several years. There is that essentially line item veto because of the process by which Krabbe was added to the screen through legislative mandate rather than through the usual recommendation to the Director of Health. Next slide. For Pompe, we started in screening in 2017. We've had 73 positive screens, 5 severe infantile, 4 late infantile, and 31 later onset, generally adult onset conditions. There are still 4 considered at risk and 6 pending. Next. For MPS1, screening started in 2016. We've had 225 positives with 7 severe diagnoses, 1 attenuated, and 11 at risk. Next slide. XALD pilot screening started in 2021 and is population level. As of earlier this year, we hope to be fully implemented and officially on the newborn screening report by the end of the year. We've screened over 60,000 babies with 11 positives. We've had 1 male that carries XALD mutation, so is being monitored for cerebral disease. There's 1 female carrier that's been identified, and 1 baby was diagnosed with Zellweger. We have 8 additional cases that are still pending a final diagnosis. So our positive predictive value for any disease for these conditions, any disease includes early onset, late onset, or children that are entered into a follow-up pathway to later determine their phenotype. For Krabbe, it is quite low. The positive predictive value is quite low because of cytosine, and quite good for ALD, although that is limited by the small sample size so far. I see there are some questions in the chat. Do you want me to save those for later, Anna, or should I try to address them now?
You can go ahead. It's up to you and Dr. Orsini.
Okay. So in Ohio, what does late onset Krabbe diagnosis mean? And are they actually symptomatic now? So from a newborn screening lab perspective, there's no way for them to systematically know if babies become symptomatic. They look for, so the state lab collects the clinical diagnosis up to 1 year of life, and then the lab is no longer involved officially in the data collection and following those babies. So late onset disease means that's what whatever clinician was taking care of those patients felt like they had. And so whether or not they're symptomatic now, the state lab doesn't have any way of knowing. Okay, I think that covered the Ohio questions. Thank you.